urban Cook County on radio, social media, billboards, and buses. This message could not come at a better time. With a triple threat of COVID, seasonal flu, and RSV looming, now is the time to boost up so you have full immunity before gathering with friends and family at Thanksgiving and all the holidays to come. We invite you to take a look at our spots throughout the county and share the message with your friends and family. As I mentioned earlier, we're also proud to announce the recipients of the latest rounds of Building Healthy Community grants. Thanks to a combination of funds provided by the county through our American Rescue Plan Act resources, the Centers for Disease Control and Prevention, which of course is federal, and the Illinois Department of Public Health, our state agency, organizations supporting programs related to COVID-19, prevention and treatment, as well as mental health, food security, and healthy development of our young people, will now receive funding to support their efforts in neighborhoods throughout Cook County. We're doing this because equity is at the core of everything that we do in Cook County. We're committed to using an equity lens in policy and practice to help our most vulnerable residents first and foremost. Building healthy communities will lessen the impact of COVID-19, stimulate the economy, and build healthier, more resilient communities throughout our region. The initiative specifically supports evidence-informed programs and systems change strategies that make Cook County a healthier place to live, work, learn, and play. Working with grassroots organizations is critical in reaching our most vulnerable populations. This strategy also helps us build trust within those same communities for sustainable and transformative change. Now, I'd like to bring to the podium our CEO, Israel Rocha. Israel.
Good afternoon.
Good afternoon.
Thank you. Thank you all so much for being here today, and thank you as always to President Preckwinkle for her unwavering support of our health system's work and the advocacy of healthcare as a human right. I'd also like to thank Commissioner Britton today for his dedication to improving the health of the residents of Cook County and always making sure that we have the resources that we need and calling on us to prepare any resources that we need for our community so that we make sure that we're ready and that we are in advance of the services that we need. Since the start of COVID-19, Cook County Health has been striving to ensure that all people, regardless of their ability to pay, their immigration status, their race, their community, or any other dividing factor that has long made healthcare sometimes out of reach, is resolved. We have been committed to ensuring that those differences, that those changes, those things that are needed are put into place so that everyone can have healthcare when they need it, especially in the face of viruses like COVID-19, SRV, the flu. We have all learned that viruses, infections, respect no borders, no boundaries. And if we are all to remain healthy, we are in it together. And so we have been working carefully to make sure that everyone has open access to the healthcare services they need. Our service to our mission and our commitment to equity has never been more important, and not just important for our mission, our organization, and our community, but important to everyone all, individually and collectively. We know that the pandemic continues to have long-lasting effects in our communities. COVID-19 has shed the light on the deepest and most pervasive health inequities across our community and exacerbated challenges that negatively impact people's health and well-being. That's why the Cook County Health System and the Cook County Department of Public Health have launched our Building Healthy Communities program earlier this year. The Building Healthy Community program aims to strengthen capacity and collaboration of local organizations to advance community solutions for inequities that exist in our community. We know that funding opportunities for COVID-19's response, recovery, and resilience are critical to prevent the control of the spread of COVID-19 and other variants in our community, and to lessen the pandemic's health, social, and economic impacts that address COVID-19 health disparities and health disparities in general. As part of the Building Healthy Communities program, we have invested more than $8 million in grants to address our community's most pressing health needs, particularly mental health, food inequity, and positive youth development programs. These funds come from the American Rescue Plan, the CDC, and the Illinois Department of Public Health. $7.4 million have been dedicated to suburban Cook County for programming, and another $1 million has been dedicated to City of Chicago programming. I'm proud to say that in all, 52 organizations have been awarded grants under the Building Healthy Communities program, including our partners for our community and centers of concern who are here with us today. All across of our awardees, programs that were funded will increase access to resources, programs, and services to lessen the spread of COVID-19, support culturally and linguistically appropriate education and outreach, augment programs and services for mental health, positive youth development, and healthy food access, and improve working conditions for worker health and safety throughout coalition building and outreach for education. I'm looking forward to seeing these amazing programs and the amazing work that the grant awardees are doing come to fruition. I will also take this time to remind everyone that we have a separate $14 million program for behavioral health services in suburban Cook County that is now accepting applications. The deadline to apply is December 7th. To learn more about this program or to apply, visit bhcopencall.com. Again, that's BHC, the letters, BHC, opencall.com. This is what commitment to health equity looks like, translating real resources, partnering from the county level with excellent leadership onto the communities who serve the patients before us. This is how we move the needle on improving the health status of our community and ensuring that health is a human right for everyone. Now I would like to say a few words in Spanish. Para resolver las desigualdades en la comunidad que aumentaron durante la pandemia de COVID-19, Cook County Health y el Departamento de Salud Pública en el Condado de Cook han otorgado más de $8 millones en subvenciones en organizaciones comunitarias. 52 organizaciones han recibido subvenciones para crear programas que tratarán nuestras necesidades de salud más urgentes, en particular la salud mental, el acceso de la comunidad y el desarrollo pasativo en los jóvenes. Estos programas nos ayudarán a reducir las inequidades sociales y para provocar las saludes de la pandemia. También me complace decir que estamos ofreciendo 4 millones de subvenciones para apoyar los servicios de salud del compartimento en los servicios del condado de Cook. La fecha límite para aplicar es el 7 de diciembre. Con todo ese trabajo esperamos a mejorar las vidas de los residentes del condado de Cook. We're so grateful to be here, and again, want to thank President Preckwinkle, Commissioner Britton, and the entire Board of Commissioners and our entire board at the health system for helping us to be able to create these resources, to help to resolve inequities, to make healthcare meaningful for everyone, and to translate solutions in health to the people who need it. And so we thank for their support, thank them for their work, and look forward to this work coming to a community near you. Now I am happy to bring forward Dr. Lamar Hasbrook.
Hold on just a second. I screwed up.
Okay.
I'm sorry. I messed up. How's that? Better? All right.
Oh, Commissioner Britton.
Commissioner Britton should be
Yes. So I'm sorry. Happy to bring forward a person who is always advocating for our community, Commissioner Scott Britton.
Thank you, Israel. Thank you. Again, I have to thank Cook County Health, Cook County Public Health, and of course, President Preckwinkle, who is the center of everything we do for health equity throughout the county, including here in the suburbs. And thank you for coming to the 14th District. We must not forget that we are still in the middle of at the end, I hope, of a pandemic, and the dangers of COVID are still with us. Case numbers are low now, but as recently as May, Cook County was designated by the CDC as a high level of COVID transmission. With winter on the horizon and more of our community members staying indoors, we must remain vigilant about our well-being. Get your double shot of health, a COVID booster and flu vaccine, of which I've had both, and be safe at all times. We are grateful for Cook County Health and the Department of Public Health for ensuring that residents in every corner of the suburbs are vaccinated. The county has worked hard so that all residents of the northern suburbs that I represent have access to this vaccine. The county supported its first-in-the-nation vaccine center at New Trier High School in partnership with MABUS 3 and municipal first responders from multiple jurisdictions. We opened a mass vaccination site in Des Plaines. And of course, we thank the incredible efforts of the medical professionals at the Arlington Heights Health Center just down the road. Cook County Health has partnered with my office on nearly 4 dozen mobile pop-up vaccination clinics in my district over the last 2 years, like the CCH clinic held right here at Partners for Our Community in August of 2021, the mobile clinic in Sunset Village in incorporated Northfield Township just last week. But the county's efforts towards health equity only begins at vaccine access. According to the Heartland Alliance, half of the region's poor populations live in the suburbs as of 2011. And poverty in Chicago's suburbs has grown more than it has grown in the city, outpacing even population growth. Hyper-targeting services and funding to the communities and residents most in need allows the county to have the greatest impact. This Building Healthy Communities grant program is an example of the ways Cook County is investing in suburban health providers to meet the growing needs of our community members and build public and mental health capacity in the northern suburbs and throughout Cook County. With partners like POC and Northwest Community Health, we are able to reach those who have been historically underserved and build on our dedicated health equity efforts. And now I believe it is now time for Dr. Hesbrook.
Doctor. All right. Thank you for cleaning that up.
Thank you, Commissioner. So I want to thank President Preckwinkle, Mr. Rocha, our community partners here as well as always. We can't do anything without leveraging the community partners. So what I'm going to say is going to be a little bit repetitive, but I think in a moment like this and a sense of urgency, it's okay to have some redundancy. So I'm Lamar Hasbrook. I run the Cook County Department of Public Health. And I'm delighted to be a part of the press conference here. I'm delighted to be in the district of Commissioner Britton. But I'm ecstatic to share the information and the good news, as has been mentioned, because it represents just another opportunity for us to partner with you in the community. So the health department in the county has resources, we have programs, we have various initiatives, we have great ideas, we have best buys, but they mean little unless we can actually mobilize the community and activate the community to improve and give them optimal opportunities for health. Obviously, the pandemic has revealed a lot of gaps, a lot of opportunities. It's resulted in an infusion of cash and resources, which is great. And so we have the Building Healthy Communities grant that has been mentioned, 2 of them actually, and they're aimed to make stronger, more resilient communities. 52 recipients, as mentioned, 39 in suburban Cook, 13 in the city, totaling $8.4 million. So these are really to address the challenges that have been amplified during the pandemic. And our partners here are going to be very important for helping us to do that. So we feel very confident that we can both activate the community, but also mobilize the resources for the community through leveraging community partners. Given that they have the tentacles throughout the community, we believe they can help us with every effort to improve the opportunities for optimal health, including the latest campaign, which is called Boost Up Cook County. The simple scenario is this, it's been mentioned, but I'll reinforce it as the director of the county Department of Public Health, is our community is not up to date with their boosters. In fact, only 11% of folks in our community have received the current customized booster. And if you haven't received the current booster that's customized for Omicron and the other variants of concern right now, then you're not up to date on your boosters. And that's what the 11% represents. It has been mentioned by the President and Mr. Rocha and Commissioner Britton. It is a triple threat season that we're bracing for. So we have COVID and other variants of concern. There could be new variants. There likely will be new variants. There's a seasonal flu. Every year, 50, 60,000 folks across the country die of the seasonal flu. And then we have RSV, which is also an influenza-like illness. So we are facing this triple threat, and we want to encourage residents of Cook County to give themselves and give their loved ones the boost of health through the holiday season by boosting up and getting current with your boosters. So it's been mentioned, we have the campaign. We're trying to mobilize and activate through the campaign. We're counting on all 52 of these grant recipients and more, our other community partners and networks, to make sure they get the word out. We're going to be working with several radio stations, WCGI, Inspiration 1390 Radio, iHeart Media. There'll be ads and billboards and concerts. A big jam hip-hop concert we'll be sponsoring. The Biggest Give and Receive gospel concert we'll be sponsoring. Again, all to conspire to get that energy to activate and to mobilize. So we hope that these partners, and I'm sure they will, help us to propagate the good word that we do have the customized booster out. And we can really thwart the threat of a bad season, a bad winter season, by making sure folks get boosted up and get up to date. So with that, I'll end my comments, but I want to introduce our community partners so important to everything that we do. Karen Baker, Executive Director, Northwest Community Healthcare, and Kathy Millen, Director of Partners of our Communities, and you'll be hearing from them in turn. Thank you.
Thank you. So I just want to say a couple words on behalf of both Northwest Community Healthcare and Partners for Our Communities. These are the two organizations who run the Community Resource Center where we are today. When the pandemic hit, we knew that we were going to be really challenged because the people we serve in this community are pretty much the most vulnerable, and we knew that it was going to require a lot of extra efforts, including education. We had to explain the virus to them. We had to explain the importance of stopping the spread, of getting tested, and eventually those misconceptions about getting the vaccine. And we didn't know how we were going to do it until we got this incredible grant from Cook County. So a heartfelt thanks to that. Some of the things that it allowed us to do besides education is we hosted vaccine clinics here and in the community. We banded together our community health workers from the hospital along with POC staff to go to people's homes as they were being identified at the hospital or at discharge time. We knew that their families needed food. They couldn't leave their apartments, which was very challenging. Many of them had lost their jobs due to the pandemic, and we also knew they needed cleaning supplies, they needed more education. So all of those things really, really helped us reach out and impact this community in such a good way. And I guess it's just important to stress that we couldn't do it without each other. We need the county, we need all of us in this building, we need everyone in our community to band together to make sure we get this under control. And the new Boost campaign is amazing. It's going to help us continue the word. It's going to make it easier for our staff to walk around with that QR code and get people signed up to get their boosters. And again, just to stress the importance of it as we're going into this season. So thank you.
Hello, and I'm Kathy Millen, and I just want to say again, I am humbled and so proud to have a relationship with Cook County, and it started 2 years ago with this grant, but prior to that, Cook County, when there were opportunities to serve the youth, the underserved youth in our community, they would be the first to step up and tell me about these ideas so we could better expand our reach. So with the current grant right now, speaking from what Karen Baker just said, we will be looking at the food pantry that we have here in the building that is run by All Saints Lutheran Church in partnership with POC and NCH. We are now seeing upward to 4,000 people a year that are vulnerable for food. When these individuals come in, not only will they receive food, we are hoping to help them with clothing. These are all very, very important and essential items in the lives of our families. But please know that as we meet these individuals, we'll be telling them about this campaign. We are also offering many other ideas for them that they can really improve their lives and be safe and be able to have their families safe so they can continue to go to school, continue to go to work, and live the life that they need. Every person that comes into this building is greeted with love and respect. And now, with this grant, we will be able to expand our food pantry, make it more efficient, have staff that and have the integrity to work with the individuals that are most at risk. And we are looking forward to continuing this partnership. Please, please know that we could not do this work without Cook County, and I'm ever so grateful for your help. Thank you.
Thank you. Do we have questions? American Rescue Plan Act resources, Centers for Disease Control and Prevention, CDC, that's federal, Illinois Department of Public Health. So it's our county resources from the federal government, Federal Centers for Disease Control, and the state Illinois Department of Public Health.
Who's eligible to receive the services that are provided through this grant?
In this building, anybody who
Why don't you come to the microphone, please?
In this building, anybody who walks through the door is offered services. By a majority of our agency partners, we have 17 agency partners here. I think Harper College is bounded by some set geographic boundaries, but the food pantry is open to anyone who comes, definitely.
So there is no economic threshold or anything like that?
No, we are trusting the people who come to us are really the most in need, and we haven't really had any issues with that. And unfortunately, the people we're serving right now, a lot of them are people who have never used a food pantry. You know, they are faced with inflation. They're having challenges of, am I going to pay my rent or put food on the table? So it's maybe the working poor, you know, where historically they had never used the pantry. So that's why our numbers have gone up so much, serving 4,000 a month versus what we're serving about 400 a month about 3 years ago pre-pandemic.
I had a question for Dr. Hasbrook. When you announced the grants on October 26th, there was this deadline suggestion of Halloween to get vaccinated ahead of the holidays. Do you know, is the 11%, is that specific to a certain community within suburban Cook, and how is that going?
No, that's a global percentage. When we were at that press event, it was at 9. So it's ticked up by 2% since then.
All right, and we're seeing, I literally just got a text from someone I know who's tested positive for flu. So it sounds like the treatment for that, the isolation required is kind of online with COVID. What are you seeing in terms of, could you give us an update in terms of flu and RSV that you're seeing in the hospitals?
Well, I think that RSV, we're seeing a little bit more than our baseline. In terms of flu, we're right on track with what we normally see, so we're trying to get a jump on the flu. And then, of course, we know that in terms of COVID, the rates seem to be going down. We have kind of a low transmission rate rating currently. What we're trying to do is hedge our bets, because going into the winter, we anticipate there may be a surge, and if all these three collide, then that might overwhelm our hospital system again, and so we might be in a situation. So we're just trying to get out in front, and I say right now is the kind of that golden period to try to get folks boosted up, which is why we're promoting this campaign.
Anything else? All right, we'll check the press line. Is there anyone on the press line? Mike? All right, thank you, everybody.
Thank you. Thanks.